But I started telling my key people at work, my team,
Yeah.
and if it wasn't for them, I could have never done this. If I had done this by myself, not told anyone, it wouldn't have worked.
You're back at the Faculty Factory podcast. I'm Kim Skorupski. Thank you so much for joining us. On today's episode, we have a three-peater now, Dr. Rachel Salas. Hi, Rachel.
Hi, Kim.
Well, everybody, Dr. Rachel Salas is our assistant medical director with the Johns Hopkins Center for Sleep and Wellness. She's a professor of neurology. She's going to correct me if she has any new or different titles, but Dr. Salas was here on 2 episodes ago. So I would urge you to go back to episode number 92, where she talked about strength-based psychology. She's a Clifton Strengths Inventory trained coach. And then on episode 199, she talked about coaching and using a strength-based approach, and really, really great conversation. I was looking at my notes from the last episode for number 199. Gosh, we talked about Roy Ziegelstein's Personomics. It's not about the nail, which is a great little story there. She shared with us that research shows that when we feel valued, when employees feel valued, they are 6 times more likely to be engaged, 3 times more likely to highly rate their quality of life. So there's a lot of benefits to a strength-based psychological approach. And I just want to turn it over to Rachel, because Rachel is going to share with us, I think, something really important as I coach faculty members and leaders across the country. When it comes time for big decisions and making a decision to change, how does that come about and how does that happen? So Rachel's going to share her change leadership decision. And go ahead, Rachel, just start us off and how this great news came about.
You know, I think I'm going to start with when the pandemic hit. I kind of had a little bit of time to reflect. And I'm originally from Texas, pretty much did all my training in Texas before leaving to come to Baltimore to do my sleep medicine fellowship. And then have been, joined faculty in 2008 and have been at Hopkins and in Baltimore since then. Right after, maybe a month after the pandemic hit, I stopped traveling. And I know as faculty, many of us travel quite a bit. And I realized I'm so far from my family. At the same time, my mom, she's gotten a little older, and, my sons were, they're getting older. And, I always had this thought about getting back to Texas. And, before you know it, 16 years had gone by. I just had some reflection. I was like, I think we need to head back. And I spoke to my ex-husband, who's also a physician, also from Texas, also wanting to go back. And I'm like, I think we should do this, And so we started making plans. But initially I thought my plan was to do kind of a hybrid. So I was like, I think I could make things work where I could kind of live a little bit in Baltimore and live a little bit in Texas. And so that's where it started.
Wow. So that 16 years where someone's going to be, that's an important point, because so many times, many of us say, well, I'm going to do this for a minute and then I'm going to go back to or do whatever. And that's the whole, was it Bob Dylan who said life is what happens while you're busy making plans, or one of those wise sages, or maybe it was Oprah. I don't know. That I too thought when I was back at Rush University Medical Center in Chicago, doing my gerontology research at the Rush Institute for Healthy Aging and trying to desperately to get an R01 and submitting it every cycle, and just sitting in my little office every day, crunching numbers, writing papers, writing grant applications, and thinking one of these days an R01's going to hit, an R01's going to hit. And it was 2003 when the NIH kind of dried up, and our director said, hey, if you don't, at a faculty meeting, those of us who don't have 100% of our salaries covered on by grants, we're going to cut your salary in half. And I was like, what? So I went, running around to go back to my default, which is to be an adjunct professor. So I'm, getting gigs at Northwestern, University of Chicago, UIC, thinking I'd make up that salary somewhere. And then just 2 weeks before that deadline, the director came to me and said, "Hey, my colleague, as part of his retention package, wants to start a mentoring program for junior faculty members. He, half-time program director." And I told him, "You'd be great at that." And I was like, "What?" And I thought, well, it'll cover half my salary, so I'll do that until my R01 hits. And that was 2003. And here I am, 2022, doing faculty development at Johns Hopkins. Who knew? I mean, that is kind of an interesting, as much as, we're always kind of coached and mentored to have a plan and a 5-year goal and 10-year plan. Sometimes you just don't know what's going to happen. But so you had the 16-year, like, whoa, 16 years have flown by, and what next?
Yeah. Yeah. And I was ready for, I was ready for, honestly, not just a change, but a transformation. I was accepted into the Alpha Omega Alpha leadership program. So the AOA is our medical honor society, and honored to be selected as one of the fellows. And in that leadership program, we had to have a project, and I can talk a little bit more if we have time on that. But part of it was this inward journey, and I think, at the start of the pandemic, when we had decided to move back, we didn't have like necessarily a specific timeline. But when I got accepted into this AOA program in 2021, and I started reflecting more, about this inward journey and who I am, who I want to be, how do I occur, I decided, I need something big. I need a transformation. And so it was it was in May 2021 that I said, I'm going to move back to Texas in a year.
Wow. And when you were on that journey, and I love that you shared that. I didn't know that was part of that fellowship, the leadership program, that you're reminding me a little bit of an offshoot, of course, because I'm great at taking these side roads. Heather Broad, my colleague, who's a coach, she used to be at Ohio State University in faculty affairs and development. She and I, for months earlier this year, developed a weekend retreat, a mid-career coaching development program. And we spent a weekend with 12 of our graduates of the mid-career women's program here at Hopkins. And that was what we were trying to get at, was this transformative inward journey of what are my values? What are my beliefs? What are the assumptions I hold? And how do I, giving them some fundamental coaching skills on being curious and non-judgmental. And I think and we purposely picked our mid-career faculty women because that's where we're finding, some level of dissatisfaction and being poached. And, you're kind of in that stage of like you described, Rachel, like, what's next? I mean, is this it? Is this now where I'm done? Like, how do I dig deeper and put in deeper, stronger roots? Or how do I spread out, go deeper? Is this spreading out? How do we, manifest the next iteration of us? So I like how you were courageous and brave and made that decision that was going to happen. And I want to hear like how you involved others in that decision, or if that was kind of like, okay, this is me. I'm making this decision personally. I want a transformation. Now, how do I get everybody else on board? Or were you getting some of those kind of little whispers in your ear from, mom saying, gosh, Rachel, it'd be great if you and the boys were closer home, or your ex-husband with whom you're really close saying, I'm getting tired of the drag. Like, do you think it was purely an internal decision, or what effect did other factors have on that decision? And then how did you move it into the space of everybody else signing up?
Yeah, well, first I'll say that I wasn't dissatisfied, which I think right now in the pandemic, burnout, and that's even more elevated in healthcare and academia. I wasn't dissatisfied. I was actually excited. I was already doing a ton of coaching. Everything I was involved with. I'm doing a lot of work with the AMA and health system science. Just really excited about who I was working with and what I was doing. But I felt something about wanting to be bold, right? And do something just do something different and exciting. But I wasn't ready to leave Hopkins, right? Because it's really easy. I could have said, I'm moving to Texas. I'll find another job and kind of do the standard. And Kim, you know me. I like to do new things,
Right.
and build new paths. And I was like starting several programs and have such a fabulous team at Hopkins that I was like, I'm not ready to do that. So how can I make it work? And so when, after talking to my family, but I wasn't getting any pressure. This was something that I had always wanted to do. We were always going to come back to Texas at some point, and it just took a lot longer than we thought. But I started telling my, key people at work, my team, and if it wasn't for them, I could have never done this. If I had done this by myself, not told anyone, it wouldn't have worked.
Mm.
And I will say initially, like I said, I was going to do a hybrid approach, but at somewhere along the way, for a few different reasons, I decided to shift over and say, you know what, I'm going to actually move, but somehow still be full-time at Hopkins.
Mm. Well, you're describing something that, and it's clear from, and those another little deviation, folks. If you don't know the Clifton Strengths-based inventory and psychology, Rachel Salas shared with us on her last episode. Again, that was episode 199. Her 5 topmost strengths are individualization, strategic, adaptability, arranger, activator. And so it's clear the way you're talking, how this being bold, looking for big transformative changes fits in with, those are your strengths. Those are clearly part of your personality DNA. And so what I also really enjoy about the way you're describing this is the courage that sometimes, it's scary to make these big changes. And you described a couple of things. I'm not sure it was going to work. If I didn't involve anybody else, I've got a great team. I'm not dissatisfied. So sometimes I think we can talk ourselves out of these courageous, bold moves because we're safe, we're secure. Why mess with something's good? If it ain't broke, don't fix it. Why you want to rock the boat? And yet sometimes there's this yearning to go big, to dig deeper, to go broader, to say, what else? What next? How else can I stretch myself? So I think we can all do that at a micro level. It doesn't have to be move across country, but I like how you are painting a picture of the possibilities and without kind of busting down these sometimes self-imposed boundaries or borders. And we say, oh, we couldn't possibly do that. We can't do that. Why not? That you showed that clearly that self-reflection and deliberation and thoughtfulness and being strategic ended up working out beautifully.
Yeah, I mean, it was challenging because there's a lot of moving parts, but like you mentioned, my strengths of adaptability and arranger, I can have many, many plates in the air and not know where things are going to land and kind of lean on my adaptability to just kind of deal with whatever comes my way. And so there were a lot of moving parts, but again, this is very comfortable for me. I wasn't afraid. I did kind of, have second thoughts along the way. But I really leaned into my adaptability. I said, it's okay if things don't work out and I need to leave Hopkins completely, that's okay.
Yeah.
That's okay.
Yeah,
And
you'll land on your feet. That kind of safety net and confidence and faith that it's going to work out. If I've collected all the data I can collect based on, what I know now, and after thoughtfulness and deliberation and rational, and then looking inward to your emotions, what you feel, that kind of at some point you just say, I'm going to jump and let the cards fall where they may. And fortunately, in academic medicine, faculty members, we're privileged with the education and the training, and it's not as if, thankfully, we like the odds are against us starving to death. That we'll be all right.
Yeah, and I'm very grateful. We both do a lot of coaching, but during my leadership program, The AOA had provided some funds that I could use towards my own development. And so I did more coaching. I got certified as a master professional life coach.
Oh.
And I got myself a coach. I got, and a shout out to Carrie Bischoff, who's the one that first introduced me to coaching and strengths. But I met with her every month and told her, I got this move and, I want to do it Texas. So I actually had once a month, a 1-hour phone call with her to kind of check in. And I think that was key for me to kind of continue and kind of reflect as I was going. I don't think if I had that, it's very likely I could have postponed my timeline. But every month I knew she would have me set my goal so that every month when I had to call her, she would ask me, did you achieve what you said you were going to do? And she actually wrote them down and told me, this is
accountability.
Yes. And I wanted to be like, yeah, I did it. And then before I knew it, I was moving to Texas.
Wow. So talk to us about the getting support and all those pieces and parts. Like, how did you tie up all those loose ends? What was your game plan in saying, okay, my patients, the learners, my colleagues, my boss, the leadership team here? What, without too much detail, but how did you manage those conversations, and how did you convince people like it's going to be okay? I got this. Was there any bumps where you had to really work a little harder with certain folks to convince them that this was going to be okay?
Yeah, certainly. I think there were some bumps and a couple of mountains. Initially, when the pandemic hit, like most clinicians, we all went to telemedicine. And I'll say that with my time at UTMB, University of Texas Medical Branch, for med school and residency, I was doing telemedicine as a student and leading a neurology clinic as chief resident back then. And so the shift for me in tele was very easy. And I will say that not all specialties are set up for telemedicine.
Right.
But sleep medicine is. In fact, it's even more valuable because as I'm doing consultations, usually people are calling from, their maybe even their bedroom, but their home, even their offices. And I can tell you that I've been able to give some feedback, for some patients that have insomnia, for example, on their environment. So I was already doing that. And so as far as my clinical, it was looking very promising that I could actually, and at some point I even told, our center, I said, if okay, I'd like to continue solely with tele sleep. And this is while I was, back in Baltimore. So I already knew that could work. But what I did is I tried to start setting myself up as like the main person doing like kind of tele kind of outreach, kind of growing the program. We were all doing tele, but I wanted to kind of open up new avenues. So it was back in the fall of 2021 that I said, let me get my Texas license, because if I can start building a practice, for like consultations for people, because I knew there was a need in Texas. So I got my license and all that paperwork, people knew I was getting a Texas license, but at the same time, I was showing like I was opening opportunity for our sleep center to have a reach. And it was in the priorities of Hopkins, right? Trying to, look for new avenues for clinical opportunities. So, my chair had to sign off on my license paperwork, and my department knew about it. And they even started advertising for me in Texas to build that practice. So that was really, easy. And then on the education side, because I do a ton of that, I've been a clerkship director for over a decade, and we had been, trying to identify who was, my successor. And luckily I had someone for the last 2 years that I had already kind of been grooming, who's very interested. And so we brought her on in September as a co-director, and the plan is to kind of transition out. But from the get-go, I was like, you're going to come on and you'll be the face of the clerkship in person. and I'm going to be in the background, kind of continuing to groom, be there to support. We'll co-direct for a year and then kind of go from there. So I had that covered. And then my other role as the director for interprofessional education, we had been very virtual since throughout the pandemic. And even I knew we were going to continue to be virtual this year. So I knew, but that was the one position that I thought, like, if anybody was going to go back in person, it would be that role. So as of January, this is I'm in my 6th year of being the director. I'm stepping down, and they're already in the process of making final decisions. But, I refuse to be, a full professor sitting in a position. And I'm not to say that any full professor in a position is sitting in there. But for me, I'd like to open up opportunity for others to lead. And I shifted into sponsorship mode and continue to do that, but that really aligns with my values. Mm-hmm. So I made these strategic kind of moves there. And so with that those were kind of the main things I did. But then, there were some challenges as we went, through the year.
Amazing. IPE director, clerkship director, master professional life coach, professor, sleep center, sleep and wellness assistant director, and cartoonist and app designer. And folks, you can see why I'm just totally number one fan. I remember meeting you early on, and I talked about this in the last podcast episode, maybe both of them, that when I was brand new to Hopkins in 2013, you and Charlene Gamaldo were one of the first people I met within like a week or 2 weeks. And I don't even remember why I met with you, but I remember sitting there being totally blown away with your just so laid back, so chill, so like cool person. And I remember distinctly walking out of your office going, wow, welcome to Hopkins. Unbelievable genius. And so real. I mean, that's what's great about Hopkins, is that it's such a collegial, collaborative place where you meet people who are just like you, who have this growth mindset. I remember you talked about that a lot. That's just who you are, a growth mindset. And you're still doing that. And I totally agree with you, Rachel, that this was it Joseph Simon's maxims about academic medicine, that 10 years is a good time, like a term limit on leadership, that all about sponsorship, that part of our obligation as leaders is to step aside and to prepare for the next brain and set of eyes and the new creative angles and the new lens to look at and explore and examine things. And for us to create a new and also shake off old and transform and build and create. So I'm totally with you on this. I love this journey. I would love it if you could tell us about that AOA leadership program project. I'm sure it's fascinating.
Yeah. Well, thanks for all your kind words, Kim. I'll have to throw you, a little spotlight on you, because I met you, I think a little bit before we actually met in my office through the women's leadership program. I was like, early career faculty, had just started in that program. And, even back then, I mean, you have always stood as a role model for me at the institution, and, love your energy. And so it's spotlights like that at a big academic enterprise like Johns Hopkins, where you could feel, very lost and small even. The imposter syndrome actually was pretty high with me even back then. And now, I really say that imposter phenomenon is actually something helpful, whereas imposter syndrome, which I definitely had back then, and not only was thinking about leaving Hopkins back then, but was thinking about leaving medicine. And I just want to put out that, people like you, I think, serve as this, guiding light to kind of move towards. That kind of leads into my project. I wanted, I've done a ton of different programs as an educator and leadership programs. I love a good leadership program. So I say that. So, growth mindset, lifelong learner, always and forever. And I apply, and this is my activator. Some people might wonder what that is, but that's one of my strengths that was so raw for me when I first learned about it. And once I honed that, I've had a lot of success. So an activator, we can get things moving. Like I can make things happen, right? Like if I say I'm going to do something, I'm going to do it. And the timeline might take a little longer, but people sometimes apply for a grant or an award, they don't get it. And they're like, well, I guess I wasn't good enough. I'm not going to apply again. And that's not my thing. You got to play to win. And when I know I want something, I'm going to get it and I'm going to keep trying, and so through as my, development as an educator, I've kind of learned some things along the way in the different programs, different experiences. I'm in the process of right now still learning. I'm doing my feng shui certification. I know. But kind of learn things along the way. So I developed a program that we kicked off this fall for educators. But this program, working with my work BFF, Charlene Gamaldo, another sleep neurologist and educator, and a broader team too. I work with Tony Ungaretti, who's been, a great mentor, and, Rick Milter and at the School of the Carey Business School, and Jessica Beanstalk here at Hopkins, to develop this program that I have a formula for. And so the idea here, and I'm very strategic not to call it a leadership program, but it's a professional development program. And so I think it really kind of highlights like my journey when I went in, as a clinician to academia. I was a neurologist, a sleep neurologist. And now my professional identity, I see myself as a clinician educator or a health professions educator. So I'm not a doctor that teaches other doctors in training. I'm a doctor that teaches all health professions learners, nursing, pharmacy, all of that. I'm amazed to see how many people still exit, whether you could even do your master's or your PhD in education and still emerge as like, no, I'm a doctor educator. And it's like, no, you're actually more than that. And so I'm one of my values is recognition and helping others. I always say my mission in life is to help make others glitter. I mean,
yes.
I love a sparkle. And so that's what this program is. So we selected 5. It's a small pilot, and we're bringing them through. It's like, about 9-month program. And basically I've threaded in things that I felt were transformative in my journey. And I've put it all together in this one program that we're piloting in an educator community. So we started with the School of Education, the Masters of Education for Health Professionals that Tony Ungaretti created and directs. And so we selected 5. But this program, this formula can be taken and put anywhere, right? It could be for early career engineers. It could be for leader, it could be for residents, it could be for whoever.
Love it.
Yeah, it's exciting.
Again, it's hard to get me speechless, but this is just another example of, wow, you give people the freedom, and that's what academic medicine or academia is about, right? You give people the freedom and then let them create. And this is a perfect example of someone having the space and being encouraged and being in the right place to make these dreams come true and helping others' dreams come true. So you're right in to me, you're like one of those people who I give the example when you go to, a Broadway show or professional athletic performance and you see the pros up there on stage or on the field or on the court or wherever on the movie screen, you're like, oh, that's that's genius. And that's what you are. And that's what you do. And I can't help but thinking that the interprofessional education arena is where we can all kind of broaden our framework that you talk about. That professional identity is once we kind of get out of our silos and our labels of I am this, I'm a gerontologist, or I'm a program evaluator, or I'm a faculty development person here. We're almost trained to be that kind of hourglass, and we're really broad when we're in our younger years of education, and then we're told to focus, focus, focus. You get promoted if you have a niche specific area where you're the world expert in this one little, the left wing of the monarch butterfly. And then when you're in your later years, you can broaden out, the hourglass then broadens out and be more general. But I can't help, and I get it, but I can't help but think that specificity and that uber focusing comes at a loss or the detriment of us being able to look interprofessionally, and not only interprofessionally in academia, but at other industries, and how we can all leverage what everybody's doing, all humans in every facet. And so I'm a big metaphor person. So I love going to or talking to anybody in any field and I'm always like bringing it back to, ooh, that's so cool that they do that in plastics and tool and die. And we need a system like that. And we need a process like that. And so I love how you are demonstrating that openness via interprofessional education and how that vision you brought into academic medicine so beautifully that has opened up opportunities, hopefully for other people to see, oh yeah, she's right. I'm not just this. I can take this and replicate it in broader fields. So,
I talked a little while about, having imposter syndrome, and that's actually what sparked me to go get my Master of Education, right? And in that process, I think that's where I learned about the interprofessional. I mean, I had to know, it's not like I've always been interprofessional, back in high school. Interestingly enough, I went to, my high school was called Health Careers High School. And so back there, I took courses like medical technology, patient services, phlebotomy, these kind of things that exposed me early on to the collaborative practice. And as a resident and med student, always like looking to my colleagues and other health professions. And when I went through the MEHP program at Hopkins, my peers were from all over: dentistry, nursing, pharmacy, medicine, not only from other specialties as well, but across the globe. It's an international program. And that's where I kind of started seeing, wow, like education's also interprofessional. I know that seems pretty simple, but that's what it was. And I hear people, at the end of the day, and this is why I think recognition is so important as one of my core values, is that at the end of the day, we're all human, and humans just want to be seen and heard for who they are. And so if I can, do that, sponsor someone else or put together a program, this program that we just kicked off is, for faculty, but you know that I have an undergrad program, the pre-doc program for pre-med students, and my Osler apprenticeship program and for the med students that has now expanded to include some of the residents and house staff. And then developing a health system science and health humanities GME distinction track as well. And all of these programs include coaching. And I will tell you that coaching that I do to connect with these others, to help them glitter, right? To help them pull out who they are, who they want to be. And it's, I wanted to kind of, there was this quote, right? You cannot be what you cannot see, right? From Marian Wright Edelman, that I think described my early career as faculty at Hopkins, where I didn't see that many women in leadership in my department back then. And certainly women of color, Latina from San Antonio, like there was no full professor that was like that, right? And so I think that kind of fed my imposter syndrome more.
Mhm.
And so I rewrote that quote to be like, if you can't be what you cannot see, to if you can't see it, be it. And so I try to do that for others.
Wow. If you can't see it, be it. Oh, Dr. Rachel Salas, I can't even stop. I filled up the page with all these notes of listing all these programs and things you're doing. It's amazing. I literally can't even, I just can't. If you want to get your feng shui sparkle glitter on, how about this, Dr. Rachel Salas, as your master professional life coach? You can contact Rachel at rsalas3, RSALAS3 at jhmi.edu. Go to the facultyfactory.org website. You'll read all about her on her episode. Check out her other last 2 episodes. Right? Amazing. Amazing. Rachel, thank you for being and seeing it.
Thanks, Kim. It's always fabulous to talk to you, and your energy is infectious, and you're a great role model, and I'm just happy to know you.
Wow. Bye, everybody. See you next time.
Thanks for tuning in to Faculty Factory Podcast. The mission of the Faculty Factory is to build and support a community of leaders in faculty development who share tools, resources, wisdom, and encouragement in service to our faculty members, schools, and institutions. We encourage you to go to facultyfactory.org to find out more, get in touch with me, ask me any questions. Maybe you want to be interviewed on the podcast. Thanks for tuning in to Faculty Factory Podcast. We'll see you next time. The Faculty Factory podcast and website is sponsored by the Johns Hopkins University School of Medicine Office of Faculty. For more information, visit facultyfactory.org.